You ask a simple question: can you put the tablet away and set the table? The response is an immediate, hard refusal. Within seconds, the volume rises. The child starts arguing, maybe blaming a younger sibling for starting a fight, or complaining that your rule is entirely unfair. The tension in the room shoots up, and suddenly you're locked in a shouting match over dinner plates. It is incredibly easy to look at a moment like this and see a problem kid acting out on purpose. But if we freeze this exact moment, there is something entirely different happening under the surface. What looks like a calculated, stubborn choice to defy you is actually a severe failure in emotional regulation. The child isn't plotting to ruin your evening. Their internal processing has simply redlined. When defiance becomes clinical, it is driven by a complex mix of unseen variables. This diagram represents a brain's emotional regulation center. For some children, this system naturally fires irregularly. They are born with an innate, difficult temperament or neurological differences that make it profoundly harder for them to naturally calm down or transition between tasks. External stressors compound the issue. Chaotic home environments, unpredictable daily routines, or early exposure to trauma act as constant, heavy pressure against a system that is already struggling to cope. A large percentage of these children are also navigating other invisible hurdles. Attention deficit hyperactivity disorder, or ADHD, and chronic anxiety are highly common co-occurring conditions that make managing impulses even harder. Oppositional Defiant Disorder, or ODD, is the result of this exact collision between a child's biology and their environment. It is a developmental hurdle, not a moral failing. Every child pushes boundaries. Refusing to put on shoes or talking back when they are exhausted, hungry, or overwhelmed is a normal, expected part of growing up. The line separating typical childhood rebellion from clinical ODD comes down to frequency, intensity, and duration. We are looking at a persistent, extreme pattern of behavior. To be diagnosed, the behavior must persist for at least 6 months. The checklist begins with emotional symptoms: frequent temper loss, chronic touchiness, and baseline anger. Next is social conflict, relentlessly arguing, deliberately annoying people, and blaming peers for mistakes, occasionally escalating to spite. Because these behaviors overlap with typical developmental phases, parents and teachers cannot diagnose this on their own. It requires a comprehensive evaluation by a qualified mental health professional. The definitive clinical marker of ODD is the damage it does. The pattern must be severe enough to impair functioning at home, disrupt their close friendships, or derail classroom success. Once ODD takes hold, families often find themselves trapped in a specific behavioral cycle known as the coercion loop. This feedback loop starts when an adult gives a command. The child pushes back with negative behavior to escape. The adult reacts by raising their voice to force compliance. Eventually, someone surrenders. Whichever side breaks, the winner's hostility is rewarded. Meeting a child's intensity does not teach them respect. It simply trains them to fight longer and harder the next time a command is given. Because the loop requires 2 participants, treating ODD relies heavily on family-based interventions. Through parent management training, adults learn how to change their side of the equation. We have to abandon the instinct to meet fire with fire. We replace chaotic, escalating arguments with structured, deliberate de-escalation. This means using a completely neutral, business-like tone of voice. You state clear expectations and offer a limited, defined choice. For example, you can finish your homework now and have screen time, or do it after dinner with no screen time. You decide. Then comes the hardest but most critical step. You state the choice and you physically walk away. By leaving the immediate space, you remove the oxygen from the power struggle and force the child to sit with their own decision. Beyond the heat of the moment, adults use proactive tools to keep the temperature down. They establish highly predictable daily routines, keep absolute rules to a minimum, and intentionally praise positive behavior. To permanently break the coercion loop, the adult has to step out of the ring. You stop acting as a combative opponent and start acting as an immovable, calm anchor. Caring for or teaching a child with oppositional defiant disorder is intensely draining. The constant friction makes adults feel completely exhausted and isolated. but there is a clear path forward. With early intervention, professional guidance, and consistently calm responses, these children learn to rewire their emotions. As the yelling stops and the boundaries become predictable, trust returns. The child gains the emotional foundation they need to repair damaged relationships and thrive in the classroom. The ultimate goal is never to win the argument. The goal is to give the child the tools they need to succeed without ever needing a fight.